Application of Dr. Leininger's Culture Care Theory by Haley Woodward. For my case study, I chose to examine the theoretical framework of Dr. Leininger's Culture Care Theory and how the theory guided my care with an elderly Hmong woman who had been living in the United States for several decades after seeking refugee status from her home country of Laos. There are several assumptions to the theory, but the concept of care and caring is particularly stressed. There have been 187 care constructs identified by this theory. Dr. Leininger stated in her 1988 book that caring is one of the most critical and essential ingredients for health, human development, human relatedness, well-being, and survival. Given this, the theory ascertains that the essence of nursing is to care and that curing cannot be accomplished without caring. Care and caring must be specific and appropriately tailored for the most optimal outcomes. The goal of nursing, therefore, is to discover practices and beliefs of the patient's specified culture and actively strive to incorporate those practices and beliefs into the professional plan of care. Doing this results in a culturally congruent plan of care in order to best fit the patient's needs. These assumptions set forth by the theory are in alignment with my own personal nursing philosophy and individual values. In my own philosophy, I believe that care should always stem from a place of compassion, patience, and understanding, and that it's my responsibility to provide safe, holistic, patient-centered, and evidence-based care. The framework supports these values through its assumptions because it focuses on the whole person by incorporating the beliefs and values considered most important to them. To approach an individual openly that has vastly differing worldviews and beliefs to my own requires compassion, patience, and understanding to do that. And by actively incorporating cultural beliefs into the plan of care, I'm providing holistic care to its fullest potential. The Hmong are an ethnic group that can trace its roots back to ancient China. They have a unique socio-political and migration history, most notably their involvement with the Vietnam conflict, where they helped the United States to prevent a North Vietnamese invasion into Laos. After an abrupt withdrawal of American troops in 1975, the Hmong became targets of the new Laos communist regime. Many escaped persecution and death by fleeing to Thailand to settle there in refugee camps. In the 80s, the United States granted preferential refugee status to the Hmong people. Over the course of several decades, Hmong have sought refugee status within the United States, with the largest concentrations now residing in California, Minnesota, Wisconsin, North Carolina, and Michigan. It wasn't until 2003 that the last refugee camp closed after the U.S. implemented a program to relocate the remaining 15,000 Hmong still in residence there. When I first met Mrs. X, she had already been hospitalized for several days. Nursing staff reported frequent noncompliance. Although English proficiency was adequate, Mrs. X was hesitant to answer questions from the nursing staff and medical team. Use of hospital translation services did not yield additional responses, and subsequently Mrs. X was labeled as a difficult patient by many of the staff. The Sunrise model is a useful visual guide to help with assessment and planning of care. Mrs. X's concerns, which we'll go over in just a moment, can all be seen within this model. The bidirectional arrows serve as a reminder for how each of the dimensions are interrelated. Once issues have been identified, action can then be taken. During assessment of Mrs. X, it was revealed that certain beliefs held great importance to her, but these weren't being recognized or included in her plan of care. Using the modalities of care, I could incorporate the beliefs most important to Mrs. X. The three modalities of care include culture care preservation, accommodation, and restructuring. Mrs. X revealed that many of the staff would make direct eye contact with her, and she felt increasingly intimidated by staff. She stated she also felt pressured to make decisions for her care without her husband present, and she decided not to answer staff at all when they asked her questions because of this. Direct eye contact is traditionally considered rude in Hmong culture. Hmong culture is also traditionally patriarchal and hierarchical in its social structure, with the oldest male in the family being responsible for decision-making. Modified dietary practices were also important to Mrs. X. Traditionally, sick persons will only consume hot foods and warm water. Arrangements were made with the hospital cafeteria not to include cold drinks or frozen desserts with her meal trays, and the nursing staff was made aware not to take cold water to Mrs. X for medication administration. Once these practices and beliefs were preserved and accommodated, suddenly Mrs. X wasn't the difficult, non-compliant patient she had previously been made out to be. Key takeaways from the theory include striving to always provide culturally congruent care. Mrs. X was unfairly assumed to be a difficult patient when really there were cultural conflicts between her beliefs and modern Western medical care. The Sunrise model is a good visual tool to help guide assessments to identify cultural needs of patients, and using the modalities of care are a method of incorporating those cultural needs identified during the assessment.